Good morning. Thank you all for being here with us today. My name is Barry Wolfman. I am the Chief Executive Officer for George Washington University Hospital, and I'm honored and glad to be able to welcome you to this event. We're here today to discuss medical body area networks, or MBANs, which I like a lot better than medical body area networks, than wireless technology. A medical body area network is defined as a small-scale network that provides short-range wireless connections among devices in proximity to a patient. Wireless monitoring is increasingly used for a wide variety of applications, such as physiological health monitoring, primarily vital signs, heart rate, respiration, body temperatures, and the potential and the future of this technology is very, very promising. With any new technology, there are often complicating issues. Just think of the multiple manufacturers with different products using different wireless bandwidths, all in the proximity of one or more patients. To ensure any wireless medical device works efficiently and effectively, manufacturers need to ensure they won't be interrupted by other devices using the same airspace. The FCC plays a pivotal role and has been discussing wireless medical bandwidths for some time with medical technology companies such as GE and Philips, who are with us today. The George Washington University Hospital has had a rich and long history and tradition of embracing advanced medical technology. At GWU Hospital, our physicians have been testing and researching the use of wireless technology to improve patient compliance in clinical research, in clinical trials with patients who have diabetes, patients using cell phones to examine patient injuries before they arrive in the ER for care, and transmitting EKGs to the emergency department while patients are en route. Anytime technology can improve medical treatment and patient outcomes, advance the quality of patient care, or improve efficiency, we are proud and are glad to embrace it. MBANs represent the future of wireless technology in healthcare, and we are again proud to be a part of that today. And with that, I'd like to introduce Mike Harsh, GE's Chief Technology Officer. Thank you all.
Got it. Thank you very much, Barry. Hey, I'd like to thank Barry, and on behalf of my colleagues at GE Healthcare, it's really an honor to be here. You know, we thank George Washington University Hospital and the staff for hosting this very important event today. You know, additionally, I would really like to thank the FCC and its chairman, Julius Genachowski, for developing today's program, and Philips, with whom we share today's stage, to preview what will be an exciting future for patient care and healthcare technology as we go forward. You know, GE Healthcare is incredibly pleased to see a ruling on medical body area networks, or MBANs for short, on the agenda for the FCC open meeting on May 24th. By opening this new wireless spectrum for communicating healthcare information through this promising technology of MBANs, patient care and disease monitoring will be revolutionized in the not-too-distant future. MBANs have the potential to improve the quality of patient care dramatically. GE Healthcare recognizes that the MBANs ruling is an important example of how industry and government really can work together and support the advancement of healthcare overall. You know, the best way for me to explain MBANs and how they can impact healthcare is by using a real-world example. Today, when a critical care patient is admitted into the ICU, he can be connected to a dozen or more cables in a hospital bed, and I'm sure we've all seen it before. It's, I think, a very dramatic picture. You know, this creates really big challenges for clinicians in caring for the patient, and really creates difficulties when you look at transport of the patient from one area of care in a hospital to another. You know, in addition, the situation literally tethers the patient to the bed with multiple leads, wires, patches, and so on. It leaves rooms for errors. There's infection control issues around this. There's just a multitude of problems with this technology we'll address. Not only does this restrict mobility and comfort, but it makes a hospital stay all the more stressful for a patient who's already in a critical care situation. Now, I just would like to show you how a patient's continuum of care can be dramatically impacted by the use of MBAN technology. Now, just imagine, if you will, even before a patient arrives at the hospital, he is being monitored with cableless sensors, transmitting vital signs such as temperature, respiratory rate, oxygen, ECG, blood pressure, just to name a few, when we look at the physiological capabilities that we can monitor going forward. When he arrives, there is no need to remove or replace sensors as he's transported through various areas of care in the hospital. His vital signs remain monitoring in a seamless fashion as he's transported throughout the care setting. Depending on the area of care to which the patient is admitted, such as whether it be ICU or cardiac care, additional cable-less sensors can be applied to monitor necessary vital signs and enable further ongoing remote monitoring. As the patient moves from critical care to general ward setting, monitoring can be scaled back just as easily without having to physically disconnect sensors. Monitoring can continue through discharge and even at home, providing patients with the reassurance that key vital signs continue to be monitored and notifying clinicians of any concerning changes. Patients stay connected to their clinicians. Simply put, healthcare providers will be able to deliver better care and be able to save more lives with this technology. MBAN technology, when I take a look at it, really supports GE's healthy imagination. It's an internal way that we look at our healthcare technologies in terms of how do we improve cost, quality, and better access to healthcare. When I look at cost, we can improve the efficiency of care overall through the use of MBAN technology. From a quality standpoint, it really enables patient mobility. Studies have shown that this mobility contributes to better outcomes, faster recovery, and an overall reduced length of stay. And with the possibility of having less infections because I don't have all these cables and sterilization control, that's another big plus for this technology. And access overall, when we look at access, we allow wireless monitoring both throughout the hospital and in the home setting. Chairman Genachowski, I want to thank you for the opportunity for GE to share our vision of the future wireless monitoring and how MBAN technologies can help change the standard of care for every patient. We look forward to the FCC's MBAN ruling in order that could represent a major milestone in wireless technology and a significant step for patient care. Now I'd like to turn this over to Tony Jones, the Chief Marketing Officer for Philips Healthcare.
Thanks, Mike. On behalf of Philips Healthcare, I also wanted to extend our thanks to Chairman Genachowski and the FCC. I also wanted to thank our hosts here at George Washington University Hospital and also our co-collaborators from GE. This event today really provides an example and hopefully a template for what can be accomplished through the collaboration of public and private organizations. And what also can be accomplished through simple dialogue. It's really important that we put the MBAN technology in the context of patient care and cost. So what will MBANs actually allow us to do differently from what we can do today? Simply put, we really want to focus on the patient monitoring aspect because that's where so many things begin with treating a patient. In a critical care setting, what you noticed earlier is that a patient is wired. Monitoring is continuous, but the trade-off is high cost, patient mobility is compromised, and the patient is in a tremendous amount of discomfort. When you move a patient to the general ward, well, we find that the patient remains at risk of serious adverse events, but monitoring is now reduced to hourly or even less in some situations. What's significant about an adverse event? If you consider recent studies, it shows that a patient who suffers an unwitnessed heart attack in a general ward actually has less than a 1% survival rate. Now, even when a patient is sent home, monitoring stops altogether. So any potential for monitoring or seeing an adverse event early doesn't exist. The result is that minor issues become major events. The patient ends up getting readmitted to the hospital, and the cycle starts all over again. So the question is, why does this occur? The bottom line is the cost of monitoring beyond the hospital has been too expensive. What MBANs does is it actually changes this equation dramatically. How does MBANs actually provide that? It allows us to monitor patients in a variety of locations beyond the four walls of the hospital. It provides a foundation that actually allows innovation to reduce cost. So now you can do this much more cost effectively. And it provides a certain level of comfort that encourages patient compliance and adherence that is very difficult to achieve today. I'm not going to read through all this, but the bottom line is MBANs provide an opportunity to really dramatically improve both clinical and economic outcomes. What I'd like to do is actually walk you through a video that actually shows this and reinforces the message. That might do it.
Monitoring networks that offer the potential to use small, lightweight sensors placed on the skin that will give clinicians early warning signals when serious changes in a patient's condition require medical intervention. New wireless technologies will change the delivery of healthcare around the world, expanding patient monitoring from the hospital to emergency vehicles to the home. Patients suffering from serious medical conditions will be able to monitor their own vital signs using smartphones to track everything from glucose levels and respiration rates to pollen counts. These devices will help speed diagnosis and allow clinicians to intervene at the earliest possible moment, enhancing patient care, while at the same time possibly avoiding the need for more expensive acute intervention. Faster clinical decision-making may save lives by giving providers the tools to act before conditions become life-threatening. At Philips, when it comes to healthcare innovation, tomorrow is more than just another day.
Again, thank you, Chairman Genachowski and the FCC. With that, I'd like to introduce Dr. Richard Katz, Director of the Division of Cardiology here at George Washington University Healthcare.
Well, thank you, everyone. It's nice to see M Health more in this on our campus. This revolution behind me is already here. At GW, we've been working in the area of M Health for 4 or 5 years already on many projects, and we're putting together an M Health working group across our campus between the School of Public Health and the medical school, the engineering school, and others. We've have projects with self-management of diabetes, hypertension, heart failure. We have grants for tracking wound healing for patients who've been in the emergency room with their iPhones. And we have text messaging successes with smoking cessation, just to name a few of the projects that have been up and going. This month, with a grant from the CTIA Wireless Foundation, to GW's Cardiac Institute, we've donated to the City of the District of Columbia to all the ambulances to be able to transmit wirelessly with a push of a button the EKG of any patient to our emergency department and our cardiology on-call cardiologist to facilitate and identify patients who are having heart attacks. And so the whole team is ready, and we're doing a study with this showing how we are really shortening the time of opening arteries for patients who are suffering from MI. There are many steps in this process of measuring a biologic measure, but be it blood pressure, be it blood sugar. However, there are some limits to the practicality of what we currently have with regards to the timeliness of getting information for care. An example would be a patient with diabetes who we've got with a mobile app. What they have to do is they have to get their glucometer out, check their blood sugar, write down the number. At some point then, get their phone, turn it on, go to the diabetes management app, open that up, put the number in. Then they will wirelessly get an instant message back about their status, and that will be also monitored by a case manager. That's a lot of steps, and here we have the potential for making that much more efficient and seamless. And something that also patients will use, because when there are too many steps, we stop using things, and when it gets too complicated. You saw that picture of the ICU patient with all those patches. My problem is I can't even get my stethoscope on the chest anymore. I mean, there's just no room for it, and we've got to do that. We have some current examples of this kind of monitoring that's going on. In the arrhythmia area, we have many patients who, they have a fainting episode, so we want to evaluate their electrocardiogram. But if we do an EKG, that's 15 seconds. If we do a 24-hour heart monitor, it's 24-hour monitoring. But that's an intermittent phenomenon, and we may miss that. And so what we do then, we hook up these patients with a couple patches on their chest and a little lanyard around their neck for a month. And that transmits to a dedicated cell phone they wear on their belt, which is constantly monitored by our monitoring company, which is able to instantaneously catch everything. And this is where that scissors is no longer broken between the observations during the hospital, where we may have a brief stay, but we need to have something more. And that is an example of a right on the body constant monitoring already. Same thing is going on with patients with insulin pumps, the diabetics who are having constant blood sugar measures. What you can do is feed that signal of what the blood sugar is to a cell phone, which will then feed back to the pump to tell you how to adjust the insulin level. So those are things that are here. You've heard about the things that are coming, though, whether it's things with patients with shortness of breath or chronic lung disease and asthma, where you'll monitor their oxygen content and can check things out. Blood pressure monitoring ambulatory monitor is in great need for one of our biggest problems, medication adherence, and just getting these feedbacks so patients are actually more engaged, as well as there's less resistance and inertia on the part of our medical system to respond when unless they get some really good data. So we've got all these future examples. Making this next step in the frontier of mobile health is going to be great, and we look forward to helping promote that with the scientific community. Thank you. And I think I will introduce our FCC chairman, and he will make his announcement today. Thank you for joining us here.
Thank you. Dr. Katz, thank you.
Thank you.
Well, thank you, everyone, for being here. It is great to be here to talk about the new opportunities of medical body area networks. It's just fascinating to listen to what we've just heard and to see the concrete examples. It's clear that MBANs will improve patient care, increase patient mobility, and encourage medical innovation. It's no exaggeration. By unleashing spectrum for MBAN, we can save lives and lower healthcare costs. So thank you. So many people to thank. Barry Wolfman and GW Hospital for hosting us, Mike Harsh of GE, Tony Jones of Philips for the incredible work your companies have done, Dr. Katz for sharing your perspectives on how these technologies will improve patient care in hospitals. FCC staff has done an incredible amount of terrific work on this. Josh Gottheimer and Charles Mathias in my office, Julie Knapp, Bruce Romano, and Geraldine Matisse in our Office of Engineering and Technology. And thank you all for joining us. Now, some people may be wondering, what's the chairman of the FCC doing in a hospital at a healthcare event with all these medical experts? For what it's worth, I was actually pre-med in college, which my mom will not let me forget to this day. It gets worse. I was certified as an EMT, and I worked on ambulances and taught CPR. And particularly my work on ambulances and my work in hospitals early in my career gave me a tremendous appreciation both of what the medical profession does, the challenges, how much value is delivered, and also in the role that technology can play, should play in the delivery of medical care. And so, as it turns out, I'm chairman of the FCC, which is the nation's expert agency on communications technology. And guess what? I spend a lot of my time on the intersection of communications, technology, and healthcare. Spent a lot of my time in other areas because what's so exciting about the world that we're in now with the rapid pace of technology change is that we're seeing not only this new horizontal technology called internet communications grow and be in itself a powerful new tool and connectivity on our smartphones, our tablets, everything else. But we see step by step the ways in which it is positively disrupting, bringing positive change to verticals of tremendous importance to all of us. Education, energy, public safety, and very much healthcare. Now, the relationship of communications technology and healthcare isn't new. Back in 1923, here's what the doctor's manual of the day said. It said that the telephone had become as necessary to the physician as the stethoscope. Well, today healthcare is being transformed once again, this time by high-speed internet access, broadband, wired and wireless, fixed and mobile. Author named Dr. Eric Topol wrote a book. He called his book The Creative Destruction of Medicine. He meant that in a positive way. He wrote, the emergence of powerful tools to digitize human beings with full support of our internet infrastructure creates an unparalleled opportunity to forever change how healthcare is delivered. Technology is helping doctors and scientists do their jobs better and faster. It's giving people access to better information, tools, and technologies. It's transforming our healthcare system. Today, a cardiologist in a large research hospital, for example, in Des Moines, is reading the EKG of a young patient in remote Iowa, spotting irregularities before they turn into more serious conditions. I've seen amazing examples of remote monitoring all over the country. In Seattle, I met parents and their child, where the child who had a heart condition, his life was saved because they were using remote medical monitoring technology, and it alerted the doctors when something was wrong at a point when the parents wouldn't have been able to see the symptoms. Here's another one. Smart pill boxes, which can send automatic reminders to a patient to take her daily medication and alert her physician or family members if she skips it. New mobile diabetes management devices are freeing patients from the burden of logging their glucose measurements and making remote monitoring a seamless process. And so since I became chairman, the FCC has been working to harness the power of communications technology to improve the quality of healthcare, lower costs, save lives. In 2009, as some of you know, we developed the country's first national broadband plan, which identified healthcare as an area of enormous promise for broadband-enabled innovation. The plan included many recommendations, which we've been implementing, and our implementation includes both broad horizontal initiatives that are creating the platform, wired and wireless, for the kind of innovation that we see GE and Philips and other companies doing, as well as specific initiatives that relate to communications technology and healthcare. So promoting connectivity is a major aim of ours. Encouraging greater broadband adoption is another aim. Think about both of these. You know, we can invent lots of technologies that can help doctors, that can help patients. If patients aren't connected, well, then they're just off the grid. If a family doctor's office or a clinic in rural America or urban America isn't connected, if it doesn't have the basic internet infrastructure, well, they're off the grid as far as these innovations are concerned. So we're working on connectivity. We've transformed our Universal Service Fund. We have for years focused on universalizing telephone service, and as a country we've done a good job, as we have with electricity. Well, we now need to be, and in fact we now are focused on universalizing broadband service. And just a few months ago, together with my colleagues at the FCC, we adopted a once-in-a-generation overhaul of universal service in the United States, updating it to broadband in a smart, efficient way, putting the country on a track to get broadband to rural America, to the 18 million people who live in parts of our country where they don't have broadband infrastructure. We also, in that major overhaul of Universal Service Fund, did something that had never happened before in the United States. We identified mobile communications as an independent universal service goal. So we said not only is our goal as a country to make sure that broadband goes to every house, we said we want to make sure that people have access to broadband wherever they are, if they're traveling on roads, if they're walking around outside, etc. And you can hear from these examples about remote medical monitoring how important that is. If you're a patient who is wearing a monitoring device outside the hospital, and you're counting on that to trigger alarms, trigger reminders, etc., gather data, and you are in a dead zone and you're driving on a road that doesn't have mobile connectivity, well, that's a problem. And another new commitment in our Universal Service Order was to make sure that in every community in the country, we're connecting anchor institutions to the internet at high speeds. Whether it's a hospital, a clinic's office, focusing on family doctors, and the issues that family doctors' offices around the country have in being able to fully participate in the new technologies, new innovations. We've also worked inside the communications and healthcare vertical to try to drive innovation. We've worked with the FDA on the first ever MOU between the FCC and the FDA, committing both agencies to work together to accelerate and foster innovation when it comes to communications-related medical devices or medical-related communications devices. And I'm pleased that our relationship with the FDA continues. I mentioned the Mobility Fund before. Of course, across the board, we're taking many steps to unleash spectrum. Spectrum, of course, it's a funny word, especially at a hospital, but it's the oxygen that fuels our smartphones, our tablets, and all of the monitoring that we're hearing about today. Without spectrum, we don't have MBANs, and without smart spectrum policies, we don't provide incentives for companies like GE and Philips to say, you know what, let's invest some R&D dollars in this, because if we develop something of value, we can get it to market. And so we understand that the FCC has an important role to play in that, not just waiting around, but making it clear that we have a set of policies, a set of processes, a climate that encourages innovation. And so I'm very pleased that it's working. And this is an example of that. Other things we're doing in this area, and I don't mean it to be just listing stuff, but since you asked, Julie Knapp is here, who runs our Office of Engineering Technology. He and I talked about this idea a year and a half ago. We want to make it easier for companies like GE and Philips and others to test spectrum-based ideas. And so we want to significantly simplify our process for granting experimental licenses. We're moving forward on granting kind of broad automatic licenses to research facilities so that we can, as much as possible, avoid a mother may I approach when companies want to test spectrum uses for medical technology on an experimental basis. And I would say in general, I want everyone to know that the doors of the FCC are open to ideas on how to continue to improve our processes so that we can encourage the kind of amazing innovation that we see with MBANs. We heard some of the statistics in the earlier presentations. About half of all patients in U.S. hospitals are not monitored. Well, that's not good, and we know that that's not good. And when we have family members in hospitals, and we've all had this experience, being with someone in a hospital, sensing something is going wrong, and having to track down someone to ask what's up, and and the process of then figuring out what's going on, it seems much less efficient than it should be in a world of modern rapid communications technologies. Well, we've heard the tremendous advances that are taking place. MBANs are the next big step. They will fuel the acceleration of this. They're also cost-effective. They're a cost-effective way to monitor every patient in a healthcare institution to provide real-time and accurate data, allowing doctors and nurses to do their jobs, to identify life-threatening problems or events before they occur. Here's a statistic that's worth thinking about. A monitored hospital patient has a 48% chance of surviving a cardiac arrest. Unmonitored patients have a 6% chance of survival. I should stop here. The real game changer for MBAN technology can be health monitoring in the home. With in-home patient monitoring, premature babies could come home faster. A father struggling with heart disease can be aware of his condition and being monitored while still at his kid's soccer game. A grandmother living alone could stay in her home and keep her independence. This new monitoring technology will result in higher quality care, lower health care costs. How does it get better than that? With MBAN technology, doctors can intervene before a patient's condition seriously deteriorates, resulting in less time spent in the intensive care unit, and also a reduction in costly follow-up visits. On top of better care and lower costs, MBAN technology can also be a new platform for new innovations, because we're not just authorizing the specific ideas that we saw today as reflected in those charts, but we're saying to GE and Philips and others, hey, look, here's a new platform for wireless communications inside hospitals, inside homes. Let's see the innovation that can improve healthcare and lower costs. To maximize the potential of MBAN technology, the FCC will consider adopting new rules permitting more intensive use of spectrum for wireless medical devices. And if, as I assume, the Commission approves the rules that we've been discussing at next week's Commission open meeting, it will make the U.S. the first country in the world to dedicate spectrum for medical body area networks in hospitals, clinics, and doctors' offices. I think that's a big deal. We have led the world in this kind of communications, health technology. We need to continue to do that. If we do our work at the FCC, if doctors do their work, if companies like GE and Philips continue to do their work, the U.S. can continue to be the world's center for communications and health technologies. The proposed rules represent a multi-industry effort to foster innovation in the spectrum band by allowing distinct but compatible users to share these airwaves. The allocation will increase spectrum capacity and enhance the reliability of wireless medical technology. The fact is, it's hard to do what we've done here. It's not that simple to manage spectrum in a way, particularly when so much spectrum is in use, that we can say, you know what, we've got to make room for, we've got to allow these kind of technologies, we've got to address the interference issues. We've done that here. We've done that here in a way that this will work. It'll be in the market very soon. You've heard people talk about the Internet of Things, and you've heard about machine-to-machine connected devices. People say these are the next great waves in what we'll see in terms of Internet innovation. Well, here's an example of these concepts coming to life. MBAN. It's a big deal, and we're just at the beginning. So I'm pleased to be here. I'm so grateful to the staff of the FCC for driving this forward. I thank GE and Philips for working in the spirit of a public-private partnership to get this done. We're looking forward to great things from these technologies, looking forward to building on this progress and delivering on the opportunities of harnessing communications technology to improve healthcare for all Americans.